Hi everyone, I'm Dr. Kate Cam and I'm an aesthetic dermatologist. Today we'll be talking about pimples or acne vulgaris. This video is part one of the two videos that I made to cover this topic. So, what exactly is a pimple? As you know, your face is filled with pores or follicles containing oil-secreting glands. We call this oily substance sebum. It is continuously secreted by the sebaceous glands and functions to lubricate the skin to protect against friction, create a barrier that prevents your skin from losing moisture, and also makes it waterproof. Not only that, it also transports antioxidants to the skin and has antimicrobial and anti-inflammatory properties. The problem starts when this pores gets blocked, usually by oil with trapped dead skin cells. This is called a comedone. If the plugging is below the skin surface, then we call this a closed comedone, more commonly known as a whitehead. If the plugging is on the skin surface, then we call this an open comedone, more commonly known as blackhead. A blackhead gets its color not really from dirt, but it's from the oxidation of the keratin that turns it black. Inside these comedones, the resident bacteria deep in the follicle, Cutibacterium acnes or C. acnes, thrives in this sebum-rich environment, inducing inflammation. This, in addition to the trapped sebum and dead skin cells, causes impaction and distension of the follicles, causing it to rupture. This discharges the contents in the dermis, inciting a foreign body reaction that leads to the formation of pus and swelling around the area. As you can see, all of this starts from the formation of comedones, or those whiteheads and blackheads. Predisposing factors includes genetics, involving alteration in the normal shedding of the skin, putting on comedogenic cosmetics like makeups or hair pomades, mechanical occlusion from headgears, hairbands, shoulder pads, and many others. Then there is the overproduction of sebum from hormonal imbalance from endocrine disorders such as polycystic ovarian syndrome, Cushing's syndrome, etc. Psychological stress may also aggravate acne, probably by stimulating stress hormone cortisol. The impact of diet on acne is still controversial. There's mounting evidence, though, that high sugar diet may contribute to the pimple formation. It may be because high sugar in the blood messes up the hormones in your body, increasing androgens and promoting inflammation. Food that are commonly tagged as culprits are milk, chocolates, and oily food, but like I said, there's still no clear data on whether they do cause acne. In the case of oily food, just be careful of getting that oil smeared on your face because that can surely result to pimples. Just to be on the safe side though, I would still recommend keeping a food diary and see if you can find any food that causes your acne to flare and then just avoid them. Acne is very common. Nearly everyone gets it at some point in life. Some would even say that it's physiologic in adolescents, since approximately 85% are affected. It tends to be more severe in males, mainly because they have more androgens that stimulate oil glands. Acne often spontaneously resolve by early 20s. However, it may still flare every now and then, especially with the onset of menses. They tend to resolve on their own without a trace. However, of course, we know that they may lead to scar formation. Also, if you constantly pick on your pimples, there is a bigger chance of infection and also bigger chance that it will leave a lasting mark on your face. So this video is meant to give you an overview of the treatments that are available to you and to give you an idea of how they work. If you're suffering from acne though, I would strongly recommend a visit to your dermatologist since a lot of diseases can manifest with acne and they can determine if you need to undergo laboratory tests or to get to the bottom of what's really causing your breakouts. Management of acne involves topical and systemic medications, and also physical modalities. I will first discuss them one by one, then later we will talk about how they are used in combinations. The topical treatments for acne are used to prevent the formation of comedones. You would have to wait about a month or two to judge their efficacy. Also, a common mistake in using them is some people only put them on the individual pimple, when in fact they should be applied in the entire area that is affected. So the first topical anti-acne we will discuss is topical retinoid. It increases the rate of shedding of dead skin cell, allowing younger skin to surface faster. It is anti-inflammatory and helps with the penetration of other topical agents. They are recommended for most patients suffering from acne and are preferred for maintenance therapy. It is fairly irritating to the skin though in the first 3 weeks of use. For more information about the adverse effects of topical retinoids on your skin, also its beneficial effects and tips on how to properly apply it, please check out my other video that is dedicated just for tretinoin in the link in the description box below. And then there is benzoyl peroxide. It has potent antibacterial effects, is comedolatic, meaning it can melt those pore plugs, and C. acnes does not develop resistance to it. If you're using topical antibiotics as well, it is best to use them with benzoyl peroxide to prevent antibiotic resistance. The problem with benzoyl peroxide is that it can cause redness and make your skin dry and itchy. Also, it can bleach clothing, so it can be problematic if you have acne on your chest or back. Luckily, benzoyl peroxide is available in cleansing solutions to cover those large areas of the body, and then you can just rinse it out. Just make sure to allow enough contact time for it to do its antibacterial effects for at least maybe about 2 minutes before rinsing it off. Benzoyl peroxide may be bought over the counter or by prescription. Then there are topical antibiotics. The most commonly used are clindamycin and erythromycin. Like I mentioned, they are recommended to be used together with benzoyl peroxide to prevent microbial resistance. Also, use with topical retinoids hastens the response and allow early discontinuation of the topical antibiotic. These three are the topical remedies that are commonly used for acne. If these are not well tolerated, other topical medications may be used like salicylic acid, azelaic acid, sulfur, or resorcinol containing treatments. Now moving on to the oral medications for acne, there's the oral antibiotics, hormonal therapy, and oral retinoid treatment. Oral antibiotics include tetracyclines, amoxicillin, clindamycin, and many others. Under tetracyclines, the most commonly used are doxycycline and limacycline. Sun protection is needed when patients are on these antibiotics since they can make your skin more sensitive to the sun. They must not be used in children because they can result to teeth staining. They can also irritate your esophagus, so never dry swallow them. Take them with at least a cup of water and wait at least 30 minutes before lying down. Hormonal therapy includes the use of oral contraceptives, spironolactone, prednisone, and other less commonly used ones like finasteride, flutamide, etc. They are beneficial in women, especially those with signs of hyperandrogenism, such as acne, menstrual irregularities, excessive growth of male-like pattern hair, like hair on the upper lips or chin. Then finally, there's oral retinoid therapy, isotretinoin. It is able to affect all 4 pathogenic causes of acne by decreasing the number of sebaceous glands, decreasing sebum production, antimicrobial effect on C. acnes. It is comedolatic and has anti-inflammatory properties. I will talk more about isotretinoin later in this video. Treatment for acne depends on its severity. For mild acne that is mostly blackheads and whiteheads, topical retinoids in combination with physical extraction is the first-line treatment. Alternate topical retinoid, salicylic acid, and azelaic acid may also be used. For mild acne with pustules, topical antibiotics are added to the regimen. For moderate to severe acne, oral antibiotic may be necessary in addition to topical retinoids and benzoyl peroxide. In women, oral contraceptive pills may be added to this. Spironolactone may also be given in addition to oral contraceptive pills. For severe acne that fails to respond to all other treatments, oral isotretinoin may be used. It leads to clearing of acne in almost all patients and results lasts for a long time. It used to be reserved only for those with severe nodulocystic acne, but now it can also be prescribed to those with tendency to scarring and those who does not respond to the conventional treatment for acne. The use of this, however, needs a close monitoring with your doctor. As effective as this drug is to treating even the most stubborn and severe acne, it also carries a lot of side effects. Most common side effects includes dry skin, dry eyes, dry nose, dry mouth, can cause your skin to peel, joint pains, back pains, dizziness, nervousness. The list goes on and on. You would need a baseline laboratory workup to determine the health of your liver, your cholesterol level, and blood cell count, and they will be closely monitored during the rest of your isotretinoin treatment. Women are required to have two most of reliable forms of contraception before starting isotretinoin, and this is because it carries the risk of severe damage to the fetus if given during pregnancy. So those are the medical treatment that is available to fight against acne. In my next video, we will talk about the physical modalities such as acne surgery, chemical peels, lasers, and many other procedures to treat not only acne but also acne scars. If you have questions or comments, or if you have any topics that you'd like for me to talk about, please comment below. And if you like this video, make sure to subscribe to my channel. Thanks for watching!